Hi there, I'm Dr. Christine Anderson, or Dr. Chris as my patients call me. I am a Los Angeles chiropractor who has been helping families grow up healthy for over 30 years, and I am here tonight to talk about the Palmar Grasp Reflex, one of the primitive reflexes that I'm doing in this series. And before I go into that, you may want to visit the video I did on the introduction to neurologic reflexes. I'll put the link to it in the description, as well as the general talk I did on primitive reflexes as a precursor to what we're going to talk about here. So maybe start with those and then come back and watch this, or after you watch this, you can go back and look at what I have to say on those. So we're going to be talking about the Palmar Grasp Reflex. Super cute reflex. This is one of the ones that is really, I don't know, it's sort of endearing because it is one that we can see, and there's nothing cuter than a little baby wrapping their hot hand around your finger. This reflex develops in utero around 16 weeks, so babies should be born with it. However, it might be a little diminished for a couple of days after birth, so give it some time to sort of kick in full on. And basically, when you put an object in a baby's hand, they are going to curl their fingers around the object, which is usually a finger, right? Now, you have to put some pressure with that. You can't just, put your finger in there. You've got to actually push against their palm for them to fully grasp on it. And then the second part of this is to actually pull away. So it's like you're pulling the baby away from wherever they're laying down, and they're going to cling onto your finger. And babies can actually hold their own weight at least for a few seconds. It might even be for 2 minutes, 35 seconds. I believe that's the longest. And there was research done on monkeys, and they showed a grasp reflex that was much stronger than that of humans. And they could hang on for 7 minutes or even 33 minutes with only one hand. And when you think about what they have to do, they have to hold on to mom as she's swinging through the trees. This makes sense. Now, humans, we're not really doing that, but it still gives the ability of the baby to survive should, say, mom lose hold of the baby, of her baby. And the baby can possibly grasp on to mom or dad or whoever's holding them so that they don't fall, at least for a short period of time. So a really cool reflex. So what happens if we don't see this reflex in a newborn after a couple of days, or maybe some weakness, or maybe they have the reflex on one side but not the other? So this is where there could be probable brainstem interference, because this is the house of the primitive reflexes. This is where they originate. And especially if a baby's hands are tucked into a fist. So you'll see them with their hands in a fist at rest, or even if the hand has the thumb inside of the fist, that's even more of an indication that there may be, or there probably is, some compression at the brainstem. Now, this particular reflex, because it is in the hand, is located at the cervical spine level. So the actual action of the muscles of the hand are innervated by the nerves that come off the neck. So this is not a brain function, it's a cervical level function or neck level function. So if this is not occurring, it may be that there are some subluxations or something else going on interfering with the nerves that come off the spine and the neck. Now, later in life, let's just say a baby does have an absent or a weak grip and it's not noticed. Well, they may have a weaker grip as they grow up. There's even some instances where kids go to like swing a bat and the bat just flies out of their hands, like they cannot hold on to the bat. Or maybe they're having trouble gripping pencils, or maybe they're having trouble with scissors because they have weakness. And this goes into the whole thing of handedness as well, because although they may be genetically or programmed to be right-handed, if they have a weakness of the right hand, they may start using their left hand more. So this is another thing to consider. Now, why can this occur? Well, it could be where they were positioned in birth. It could be the birth process itself. It could be birth trauma, especially if there's interventions, if there's hands-on contact, vacuum, C-section, forceps, anything like that. And then after birth, contractions. And so that's the necessary evil of the car seat, because that puts babies in awkward positions that they shouldn't be in. And then at home, things like baby swings and the infant bouncy seats and rock and roll things. And then as they get older, the saucers and the jumpers and all these types of things. So I just term these contraptions. Now, what can we do for this? Well, this is when you bring your baby in for their neurologic checkup right after birth. I'm checking for these primitive reflexes to make sure, first of all, they are there. And then if they're not, or they're weak, then I can do some chiropractic craniosacral therapy to remove those interferences from the brainstem, from the spine, in this instance, in the neck, so that the body can heal itself and self-regulate. Now, what about if this Palmar Grasp reflex does not integrate on time or at all? So typically it's about 4 to 5 months when this reflex appears to go away. What really happens is it integrates. Go back to that video on primitive reflexes and I talk more in detail on this. So when you rub your finger in your child's palm who is over 4 to 5 months, they shouldn't close their fingers around your finger. They should just be like, whatever, unless they really want to close their fingers around your finger and it's more of a conscious act. They might have their fingers just curl in a little bit. Maybe their fingers will twitch. Maybe their elbow will twitch or bend. So the other thing that happens too is that children with a retained grasp reflex oftentimes will go to grab on while I try to elicit another reflex called the Moreau reflex. And we're going to talk more about that in a different segment. But this is basically where I go to kind of lower the child down suddenly and the baby's hands go out and their eyes get big and maybe they might even cry. But in a child with a retained grasp reflex, like they're holding on. They're not going to let you do this, the Moreau reflex. So what are some indicators in an older child? Well, maybe they have dysgraphia. And this is difficulty in written expression, including poor handwriting and poor pencil grip. So they may do some really weird grips. So the proper grip is a pincher grip with this third finger behind to support. And that support hand, it's just resting on it. But if a child is having a full-on fist grasp, that means that they cannot use the fine motor of holding like this, all right? Or maybe they use just like their fingertips. Maybe they use a tripod where they're bringing their fingers over. So it's this is one of the things I look at in older children, and I ask them to write their name. I want to see how they're holding their pen or pencil. I want to see how that handwriting is looking, how difficult it is, and how they're also making their letters. So this is one of the things that you may see with Palmar Grasp reflex retained, That, and they also, because they're having a hard time holding the pen or pencil, is they grip it so hard that it's exhausting to write. It's like their hands cramping. They just, it's just not comfortable. They also might have the poor ability to put their thoughts to paper. So they have a lot of thoughts in their head, and trying to get them out on paper is just impossible. It's very, very difficult for them. Fine motor control skills are going to be not great. They're going to be poor because, again, this is one of those things that involves the small muscles. And if you can't manipulate to write, you're going to have a hard time with the dexterity, moving, trying to button your buttons and tie your shoes, and all those things that involve fine motor control and dexterity are going to be difficult. You may see poor hand-eye coordination. They may have poor posture, especially when they're using their hands. They may be kind of slumped over, having a hard time holding their paper, getting comfortable. They might even stick out their tongue when using their hands to write or use scissors, drawing. There is a particular primitive reflex called the Bapkin Response that's related to mouth movement and hand movement. And because of this, they may also have speech and language delays and problems. And then possibly even anger control issues, just coming from the nervous system not being in balance. So as far as the remediation, if your child still has a Palmar Grasp Reflex, is to stimulate the palm. And you can use a pencil as shown here, or most of the time I use my finger, and just rub in a circle, putting some pressure. Remember, you've got to put some pressure. And so if they're closed, you want to just rub until their hand kind of opens up. You can also do things like draw letters and numbers and ask them what you're drawing and writing. So this kind of goes back to that, it involves a large amount of the brain to sort of spatially figure out, oh, you're drawing a 0 or you're drawing a 3. So it's this is obviously for older kids, and you may not use it at first if they're having difficulty, but it's something else that you can do. All right, the next one is the Palmar Grasp Remediation Ball Squeeze. And basically you're taking a squishy, something squishy, a ball that fits in their palm, so nothing too big, so that they can squeeze the ball. And then what they're going to do is they're going to squeeze their thumb and index finger together, then the next finger, third finger, fourth finger, and then back again, and then the whole hand. And they can do this, especially if they're younger and they're having a difficult time. They can just start with this. And then you can add another level to this by having them go 1, 2, 3, 4, 4, 3, 2, 1. 1, 2, 3, 4, 4, 3, 2, 1. Sorry. Trying to make sure everything's in the screen here. And this is adding, again, another level of the brain, fine motor control, language. There's a lot of sequencing that goes in there as well. So there's different levels to this. If they're very young, you can just have them squeeze a ball if it's too much to do the single finger steps. Remember, we're taking this where a child is. You don't want to have them get frustrated. You want to take them where the level that they're at and then have them move along. So of course, if you're having any difficulties, just reach out to me. And there's my info. So you can reach me at losangeles-chiropractor.com if you're in the Los Angeles area. I can help you locally. If you are remote, there are some things that I can do remotely to help you. And if need be, I can possibly help refer you to somebody in your area. So that's it for the grasp reflex. We'll continue on with the reflexes next week. And again, if you have any questions, just reach out to me. Go ahead and give this video a thumbs up if you found it useful, and subscribe, hit the notification button, and of course share with all your friends, especially if they're pregnant, especially if they have babies, but even if they have older kids, because this can help kids thrive instead of just survive. All right, everyone, till next time, have a great week.